Hi, I'm Steve and welcome to Four Minds. Today's video is postnatal depression, PND. Postnatal depression happens after a woman has just given birth. Postnatal depression happens 3 to 10 days after giving birth, and 85% of women can get this, though 1 to 4% of men can actually experience similar feelings to PND. And because it's such a high percentage rate for women, it's considered normal. And it can be highly manageable, and it only usually lasts a few days, a couple of weeks. But 10 to 15% of women experience a much deeper and more severe version of PND, and happens within 6 weeks of giving birth, and it can happen either gradually or all of a sudden. There are a variety of different signs for PND, such as low mood, depression, tearful for no reason, you're tired, irritable and angry, feeling indifferent from your partner or child, but the key thing is not to get some of these signs mixed up, because obviously if you're feeling tired, it could just be from your newborn baby being awake all night. So it's important to keep track, but there is more on the Mind website in the description. And just because you have thoughts about harming yourself or harming your child does not mean you're going to act upon this. But it is important to seek a healthcare professional like your midwife or your GP, or even a trusted friend or family member. But what increases the chances of getting postnatal depression is past experience, most likely. Like if you've had your first child and you had postnatal depression with them, it's highly likely you will get it with your second child. Also, if you've got past experience of mental health problems, like if you suffer with depression already, then that poses a greater risk as well for getting postnatal depression. The important thing to note about depression is if you're feeling like you're suffering with it more than you feel like you should be, it's important to seek help, because then they can prescribe medication for you. Though if you do take medication, it is important that you stop breastfeeding, because the medication can go into your breast milk and pass it on to your newborn baby. Yeah, do a lot of research about depression just to make sure that you are suffering with it or just showing signs of low mood. You can visit my first video, What is Depression, right here. Low mood and depression are very, very similar, with a few added exceptions. Like with low mood, you feel sad, anxious, worry. Postnatal depression can get assessed by a healthcare professional, if it is your midwife or your GP or some other professional. You will be asked to fill in a questionnaire, and it is called the Edinburgh Postnatal Depression Scale. You probably have to fill in more than one, and it is usually within the first 2 months after giving birth. Though I mentioned in my first video, What is Depression, I mentioned a little bit about postnatal depression, about the hormonal changes can affect it and cause you to have depression because there's such rapid hormonal and chemical change happening in your body. Though it is suggested that hormonal change and chemical changes in your body does contribute to postnatal depression, it's usually a combination of other things contributing to it. So yeah, you would have after obviously given birth, previous mental health issues, lack of support, experience of abuse, poverty, and major life events such as getting married, moving house, giving birth. With poverty and major life events, it's because of the stress affecting your body. And it is the same thing for fathers who may experience similar feelings to PND. It is the exact same reasons why. And of course, counselling and therapy can help. There is a list of different types of therapy on the Mind website and also on the NHS website. And like I said about medication, you have to stop breastfeeding if you choose to take it, but it doesn't last forever. If you've just got the normal postnatal depression, the most common one, then it can just last a few days, a few weeks. But if it feels like it's lasting longer or getting worse, then obviously you need to consider going on medication or seeking therapy or counselling. Okay, that does it for this episode. Short, simple. Hope it has the right amount of information for you. And all my sources are in the description if you would like to know more, because I'm not going to say absolutely everything in these videos. It's important to read up it yourself in case I have misread something, or just for your own comfort and safety. And I'll see you in the next video. Bye-bye. And you have to have thought or to have borderline personality disorder to get diagnosed with disassociation. And you will most likely have passed unsuccessful treatment for whatever disorder they think you might have. Or be sure to check out my sources in the description. Visit my website www.4minds.co.uk, and I am on social media: Facebook, Twitter, Tumblr and Instagram. So I will see you there.